Now tonight we have a panel discussion on COVID-19 focusing on children. Our goal is to give parents clarity before the bell rings. So here are our panelists. Dr. Tina Caroll-Scott, she is the medical director of South Miami Children's Clinic. Dr. Chad Perlyn, he's the president of Nicholas Children's Pediatric Specialists. And Dr. Ronald Ford is chief medical officer of Joe DiMaggio Children's Hospital. And thank you all so much for joining us tonight. Let's begin with Dr. Ford. What are you seeing at your hospital when it comes to children impacted with COVID-19?
Over the last couple of weeks, we have had an unprecedented number of children coming through our emergency department and testing positive with COVID-19. In June, we had about 24. In July, we had about 240. And we are already well on our way to breaking that record with about 217 so far just in this first half of August. Most of the children are well enough to go home from the emergency department, although we have seen much higher numbers than we've ever seen before of children being admitted, and not only admitted, but needing ICU level of care.
Are these children with pre-existing conditions?
Many of them are, which was what we've seen all along, that those children are more severely affected. But another difference is that many of the children that are sick enough to be hospitalized are otherwise healthy without any pre-existing conditions.
Dr. Perlyn, let me ask you this question. We've heard that the Delta variant is a game changer, especially when it comes to children. Why are children at greater risk than they were last year?
So that's a great question. And certainly we know that the Delta variant is more infectious. It's definitely more contagious than what we saw a year ago when the pandemic began. What we don't know is that whether the Delta variant is more dangerous, and that's a big difference. We don't think it is. So far, the evidence seems to think that it is not particularly more dangerous. But we are seeing more hospitalizations in children, and we are seeing more children in the ICU because this variant is so much more contagious. So obviously, the more it spreads through the community, the more we see. And regarding the question about the children with other issues, we have seen many children in the regular hospital floors without issues, but those who go to the ICU have been those children with other issues. So I think we have to be careful for all of our children here in the community.
Dr. Caroll-Scott, let me ask you a question that was sent to us by one of our viewers from Fort Lauderdale. This is Joe Leonardo, who's wondering, his 4-year-old son just started having asthma due to allergies or a cold. How much is he at risk for severe symptoms if he is infected with the Delta variant?
That's a really interesting question, and I think the jury is still out on that, whether children with asthma are more at risk. But I think just in general, whether they have an underlying condition like asthma or not, the fact that this Delta variant is so much more highly transmissible, I think puts all of our kids at risk. And so, you know, it's really important that, especially for the kids who are eligible to be vaccinated, that parents get that done as soon as possible.
What are you seeing, Dr. Caroll-Scott, in your practice? How many children are you seeing coming in infected with the virus?
So we've had actually a huge uptick, I would say, in the last 2 weeks with the number of positives in my clinic. And I actually work in an area of Miami which is underserved, with primarily Black and Hispanic patients who have been disproportionately affected by this virus. And we're seeing huge numbers in this community now with people who are getting extremely sick and being hospitalized, and also having to go to the ICU and be ventilated. So yes, we've definitely seen an uptick in the last week or two.
Tell me, what are some of the challenges that you're seeing in those underserved communities?
I think the biggest thing in the community where I work, and I'll talk specifically about African Americans, is a lot of distrust. And the distrust that they have, it's valid because there's a long history in this country with medical experimentation and exploitation when it comes to Black Americans. So I think, that coupled with the racial health disparities that, we're even seeing today in our healthcare system has made it really difficult for, I think, Black Americans to trust that this virus is safe for them. So a lot of the conversations that I'm having is, is telling them that, yes, we can't discount the history. That's a fact, and all of that's true. But we're in the middle of a, raging pandemic that is disproportionately affecting communities of color. And we have to pivot now, and we have to do everything possible to make sure that we are protecting these communities.
Well, putting out accurate information is part of what we need to do. That's what we're trying to do tonight. All right, hang in there right now. You just heard about what parents need to know about sending their children back to school. Now we're wondering, when will there be a vaccine for kids 12 and under? Straight ahead, more medical advice straight from the pediatricians.